a discussion really around the whole issue of what's called PANDAS and children on the spectrum or the autistic spectrum. And the idea here is really to come at it from a Heilkunst perspective as opposed to a conventional medical perspective. But what I want to do is just kind of give you a brief outline of both perspectives, and then we can go into greater detail in terms of questions obviously parents tend to have. From a medical perspective, the whole of conventional medicine is largely based on what's called the germ theory, which means that if there's a sickness, there's a germ. And this goes all the way back to the middle of the 19th century with Rudi Verspoor, when he came up with this idea that there's a single germ for a single disease. What he ignored, of course, was the whole issue of the types of germs, types of microbes, meaning that there are pathogenic germs, like the ones that cause measles or yellow fever or typhoid, which clearly are infectious and often contagious. But there are many other kinds of microbes that were known by other scientists at the time as being situational, opportunistic, and another word that they use is pleomorphic, meaning that under the right conditions in the body, they actually served a purpose and they helped us, but if the conditions changed in the body or the gut, they would transform, they would shapeshift. A good example of this is yeast, candida yeast, which in the gut in a healthy person is just in a kind of bud form. But under stress in the gut, it will go into a filament form, and then it's able to slide in between the cells that make up the gut wall, and that's often called leaky gut syndrome. So other microbes will act in a similar manner under certain conditions. But from a conventional medical perspective, they don't accept that. They don't see that that is possible. They simply argue that if there's a germ, a virus, a microbe, a bacterium, it has to be one that is dangerous, pathogenic, infectious. But the problem here is that most of these people who have a particular condition don't necessarily have the microbe that's associated with. And a good example of this is pandis, meaning it's a condition that takes a group of symptoms and associates it with a microbe, in this case strep B category, and makes the assertion or hypothesis that the strep is responsible for the symptoms. The problem is that you can only really find the strep responsible for those symptoms in about 40% of cases. And so now they're shifting from calling it pandis to calling it pans, which leaves the strep out of it. And they're saying, well, it's just a psychological condition. They take a group of symptoms, and they're not sure exactly what causes it. Yes, sometimes strep does, sometimes it doesn't. It doesn't play a role. Of course, in practical terms, we're not denying in our system that strep can't produce those symptoms. Of course it does in certain people, but not in everyone. And the pandis condition, the symptoms that are associated with pandis, or PANS now as they call it, can be caused by many other factors other than strep. So this is where it starts to break down, that this one-to-one relationship between a supposed condition and a microbe doesn't really hold. In our system, all these things, just like autism is a condition or a syndrome that can be caused by dozens, if not hundreds of things. And they vary from person to person. Sometimes it is a vaccine, sometimes it's a birth trauma, sometimes it's inherited factors, sometimes it's a combination of all of those. So we approach it very differently. We can focus on the strep, we can deal with the strep, but really, in most cases, it's due to many other factors as well. So the strep itself is not something that you want to get rid of necessarily, because most people tend to carry it. It has a certain role in the body's kind of internal ecosystem, just like candida does. We're not exactly sure what it does, but because most people have it in one form or other, basically the idea of killing it with antibiotics doesn't really make any sense. It's the same problem we have with the so-called bacteria you find in so-called middle ear infections. They're really not infectious, but they kill them with antibiotics, and what the bacteria are really there for is to clean up a lot of junk in the ear. And if you keep adding antibiotics to a child, eventually they produce fluid in the ear, and then you need to have surgery to put some tubes in to drain the ear. So these bacteria have a purpose. They're not causing the middle ear infection. What they're doing there is actually cleaning up a lot of the toxins that are there. But I'll stop there and just open it up for questions, because then we can get a better idea of the concerns that parents have about this. So does anybody want to start the process?
I can ask a question. PANDAS isn't something that I've ever really been that concerned about, because I haven't seen that many symptoms of it in my son. But what would you treat it with? I mean, would you just treat generally for the symptoms, or would you treat it with a strep-based remedy?
Well, we would approach it a number of ways. One is systemic, meaning that the problem is chronic, it's deep-seated, and it's connected to a multiple number of underlying traumas, which we would be treating for. And as we treat for those, eventually the conditions that led to the so-called strep problem would disappear, and so would the strep problem. However, if there's an acute outbreak of those symptoms, we would approach it by treating for a number of acute with a number of acute remedies that we have to treat for those kinds of symptoms. And to the extent that strep was suspected or even found, we could treat for that as well. But the way we treat for strep is not to kill it the way antibiotics do, but rather to help the body to bring it back under control. But the best way to deal with the whole problem is to strengthen the immune system, so that the immune system keeps the strep under control. Because most people have strep at one time or other in their throat, but they don't produce strep throat, as they call it, because the immune system's strong enough just to deal with it. So that's a kind of a threefold approach that we would take to dealing with what's called a PANDAS or strep problem.
So just going through the timeline and clearing out the traumas like you would with any other symptom.
Generally speaking, yeah, because most of the things that are labeled, whether it's autism or PANDAS or depression or arthritis, those are just labels for a set of symptoms that don't really tell you where it came from and what caused it. And so therefore, if you just have a label for a set of symptoms, the tendency is to produce something, whether it's a drug or even sometimes a herb or dietary approaches that simply, you could say, palliate the symptoms, or even sometimes with drugs suppress them, but without removing or getting at the underlying causes of the problem. So yes, treating for all the underlying causes that we can identify in a case, including shocks and traumas and what we call the timeline, plus various inherited disease patterns. All of these are necessary, but of course that'll vary from case to case. Some cases are very easy to treat for, and some are very difficult.
Okay.
Okay. Melissa, did you have any questions? I know you muted yourself.
Yeah, Rudi, I was wondering, so if you do all of that and you work the timeline and it seems to get better, would the child still be prone to strep, or does it kind of take care of the strep infection as well?
Well, we're all prone to strep to the extent that our immune system becomes weakened, just like we're prone to the flu or to cold virus or whatever. There's thousands of germs out there. You could say God made the universe with people with an immune system. So it's our immune system that determines whether we come down with something or not. There's no way you can eradicate strep. But what you can do is you can make yourself inhospitable to strep, and even if you did somehow pick it up, because it's to some degree everywhere, it doesn't affect you because your immune system is able to keep it under control. So in that sense, there was a question that was posed on here, can PANDAS be healed? Well, the condition, that is all of the symptoms that are associated with PANDAS in terms of hyperactivity, attention deficit issues, OCD type symptoms, all of those things can definitely be removed simply by treating for all the underlying conditions that contribute to that. And whether another question we have here is, will my child outgrow PANDAS naturally or some form of treatment needed? Well, to the extent that you have a temporary weakness in your immune system, of course you will outgrow that. Your immune system will strengthen and basically build up a certain immunity. But if you have deep-seated blockages and weaknesses in your immune system, which would include things like vaccination shocks, emotional traumas, drug shock, inherited factors that set you up for a kind of chronic weakness, then you will not outgrow the PANDAS on its own, as it were. Oops, sorry. I'm going to just reminding me to click the question. So the issue here is not so much the PANDAS, because we tend to think, well, that's an actual condition. It's just an arbitrary collection of symptoms and giving it a name. It's like the case I had of a young lady who came to see me. She was with her mother. She was about 12 or 13, maybe 14. Anyway, she had urinary incontinence. And they went to the doctor, and the doctor gave her a diagnosis, and the diagnosis was sports-related urinary incontinence, because she only had it when she was playing sports, supposedly. So that was the name, but that doesn't tell you anything. That's not a diagnosis. That's just a label, a name for something. And so I questioned her more, and trying to find out more about the situation, and it turned out it only happened when she was doing karate. A very sports-oriented young girl, but it only happened when she was doing karate. And so I laughed, and then the mother asked why I was laughing, and I said, well, you got the wrong diagnosis. It should be karate-induced incontinence. But again, even that doesn't mean anything, except that we identified, a situation. So asking more questions, it turned out she was mad, actually, we could say colloquially, pissed off at her instructor. And so by giving her remedies for the emotional stress and feelings that she had, we were able to resolve that issue. But giving it a name is not a diagnosis, because a diagnosis has to tell you what caused it. So clearly, if you have measles and you get a diagnosis of measles, that's pretty straightforward. We know what causes measles. But to give a name like PANDAS to a bunch of symptoms and then hypothetically try to link it to strep, I'm not saying it's not involved, but it's not the cause of all those symptoms. It's involved as part of that whole syndrome. So simply treating strep with antibiotics doesn't solve the problem. You may get some relief to the extent that the strep is secondarily involved, but it doesn't deal with the deeper underlying causes that are feeding into the whole problem to begin with. So you have to take a much more comprehensive approach. Can PANDAS be treated prophylactically? Well, the prophylactic treatment is, first of all, to get yourself a very healthy immune system. The healthier you are, and that's what the Heilkunst comprehensive medical treatment does, is it builds up your immune system. You get stronger and stronger and healthier, and then you're not prey to all of the things that people tend to be prey to. You start finding you don't get the colds and the so-called flus that everyone else gets. You don't get the allergies other people are complaining about. You don't have all of these ailments that seem to afflict everybody else at various times of the year. And that's the best prophylactic. However, if you were exposed or you somehow caught it or thought you had caught it, we could treat for that right away, very simply. So that certainly is possible. Any other questions or comments? No? I think most people, the sense I get from many parents is that there's a kind of germ phobia out there. And as soon as they hear that they have strep, one, there's a certain fear about germs to begin with, but also there's, how should I put it, there's an unreasoning fear around strep because for many years doctors promoted the idea that if you got strep and you didn't treat it with antibiotics right away, that you would suffer from heart damage. You would get what would be called a rheumatic heart or something. You would get a weakened heart. But yes, there are sometimes in extreme cases people who might get that, but only people who are very, very weakened. There's an excellent book by Dr. Robert Mendelsohn, who no longer alive, but when he was practicing as a pediatric surgeon, also pediatrician, and for many years taught pediatrics at the University of Illinois Medical College, he wrote a book called How to Raise a Healthy Child in Spite of Your Doctor. Of course, not very popular with the medical profession at the time, but a wonderful book for parents. And there are 2 chapters in there specifically that every parent probably should read before they have or raise children. And one is on ear infections and the other is on strep throat. And in both of those chapters, he basically condemns the use of antibiotics and says that they're absolutely not necessary. And in all the years of his practice with thousands of these cases, he never once used antibiotics, never felt it was necessary. Of course, that's what most doctors tend to go for, is antibiotics. And all that does is suppress the problem and then give you other problems on top of that related to the antibiotics in terms of the gut flora and fauna, as well as stress on the liver, and the whole problem of suppressing something rather than getting at the deeper underlying factors involved. So PANDAS is not a disease. It's just a name for a bunch of behavioral characteristics. And then it's hypothetically linked to strep as a cause. I mean, an example of this kind of what I call pseudo-medicine and pseudoscience is the SARS outbreak in Toronto many years ago. This was a sudden acute respiratory syndrome that occurred in the city of Toronto. Suddenly hundreds of people were complaining about this respiratory ailment. And they immediately suspected some kind of bug, and they came out with this virus and claimed that it was the cause of this respiratory condition and treated lots of people with antivirals. But afterwards, when I read all the medical research and literature about this, 2 things stood out. One is that only 40% of the people had this bug in them. So all the other people who had this condition called SARS didn't have it. And of those 40%, almost half or more had so few viruses in their system that there's no way from a virological perspective that it could have caused the problem. So we're down to about 20 or 30% of people might have had the virus, and even then they had to really search for it in the blood, whereas normally if you have a viral condition that brings you down, the blood is just teeming with it. So there's no real strict correlation anymore between a virus or a bacteria and a so-called condition. They don't even call it a disease, they call it a syndrome. The same with PANDAS, it's a syndrome. And but what they mean is, well, there's a kind of a virus or a bug involved, but we can't really prove that it's causing it. But we'll treat for it anyway, which just caused a lot of problems because of the overuse of the antibiotics and drugs and everything else. So we have to get away from this idea that PANDAS is a germ problem. It's not a germ problem. It's a deeper problem linked often to vaccinations, obviously, vaccination shock, over-vaccination, to inherited factors, overuse of drugs as well. If all of these things are removed, then the whole PANDAS problem disappears. But it can take time. Every case is different. Sometimes it can be done quickly, other times it takes quite a long time. So. Okay, everything you wanted to know and probably forgot to ask.
Rudi, are kids on the spectrum generally considered weak immune system wise anyway, which is why even, you know, a Dan doctor, the one and only time that my son had a strep infection, scared me into antibiotics, saying, you know, that his immune system was pretty weak just because he, you know, was a child with autism in the first place. So that it was, you know, kind of a scary situation that she put me in, because I felt, yeah, he was, you know, immune deficient. So the strep throat was a dangerous thing, and of course she scared me with the rheumatic fever.
Yes, that's exactly that's the standard medical line. It's been that way since Dr. Mendelsohn wrote his book. Certainly, I know I grew up with that if you had a strep throat, you were going to get rheumatic fever if you didn't treat it with antibiotics. As far as the immune system is concerned, certainly these kids have immune system problems, but so do many other people in North America. You look at a number of people who get so-called, you know, colds and stuff, which we tend to call flus, but they're really cold viruses. And that's pretty endemic. Lots of other issues and problems. So we're all immune compromised to some extent just because of the way we live and eat and the environment around us. But these kids certainly have challenges, but I wouldn't say their immune system is necessarily weak. They are struggling with issues, certainly regarding the liver and the gut and assimilation of nutrients and things like that. But those are relatively easy to fix. But whether your immune system is weak or not, you're going to get scared by that line, and the best defense is to read Dr. Mendelsohn's chapter, and you just read that and realize that there's no justification for antibiotics, that this is just a scare. It's like saying, the doctor saying, if you don't vaccinate your child, he'll die. You know, I've heard doctors say this, and it's absolutely absurd. I mean, there are many things that could make someone die, but I mean, to say that if you don't vaccinate your child, you'll die when there's no scientific evidence to prove that fact. It's all fear-mongering, basically. That's what it amounts to. But, you know, when you're a parent and you have a small child and you don't know these things, of course it's easy to get stampeded. But hopefully as your child's immune system improves through treatment, you become more confident of trusting the immune system and trusting nature, but also knowing that there are alternatives to treating for these things. That drugs are, if anything, the last resort. And even then, I often question them, but they can sometimes be useful, but they have to be used right. So. Okay, well, I guess if you have no further questions, we can kind of cut this off and see where that takes us. Oh, before I forget, oh, there we go. This is the website for the blog, just in case anyone's watching this and they want to go read the blog on the PANDAS, which says more or less everything else that I've said, but a little more compactly. Okay, so I'm going to end the broadcast here then.